Hello everyone, Dr. Moses here, general pediatrician. Today I want to talk about safe sleeping measures for your infants, or just safe sleeping for your infants and your little ones. I read a report today that said over 3,500 infants die every year from sleep-related issues. That is way too many infants, and a lot of them preventable. So I thought it would be a good idea to talk about safe sleeping measures for your little ones. The most important thing is back to sleep. Since the Back to Sleep campaign began in the early 90s, the rate of SIDS, or sudden infant death syndrome, has gone down by over 70%. So always make sure you put your little ones down to sleep on their back, whether it's in a crib or in a bassinet, whether they're taking a nap or sleeping for the night. Always put your little ones down to sleep on their back. Now, the problem this has caused is a lot of kids are beginning to get what they call positional plagioccephaly, or just flatheads. A way to remedy that is to always make sure that your child doesn't sleep on the same side every night. So if your child sleeps on their back and their head is like this, the next night make sure their head is like that. And then just keep alternating back and forth. And while they're awake, always make sure that you spend some time to do tummy time so they're not always on their back. And just make sure tummy time you don't start until the cord is falling off for the newborn babies. So back to sleep, very important. The second thing is what they're sleeping on. It always has to be a firm mattress with a fitted sheet. Whether it's in a crib or in a bassinet, always a firm mattress with a fitted sheet and nothing else. No loose bedding, no loose clothing, no stuffies, no teddy bears. Nothing else should be in the bassinet or in the crib when your child is sleeping. Even if you have bumpers around the crib, those I think have been banned a few years ago. So if you're still using bumpers, please get rid of them. They're not safe. They can cause suffocation and also increase the risk of SIDS. So firm mattress, fitted sheet, nothing else, in a bassinet or in a crib. And the recommendation is that that bassinet or crib is in your bedroom for at least the first 6 months of your baby's life. So basically your baby is sleeping in the same room with you in a bassinet or in a crib for the first 6 months before you transition them into their own baby room, so to speak. Another thing that's very important to know is hats. Babies should not be wearing hats indoors. Essentially, they should not be sleeping with hats on. It can cause overheating. Overheating is a significant risk factor in SIDS, and babies tend to get rid of the heat through their head. So you want to make sure you do not put a hat on your baby when they are sleeping. Some babies have actually had the hat slip off and cover their face and their nose, obstructing their path of breathing. So please, 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 if you're doing this, make sure your babies do not sleep with hats on. Just make sure that the temperature in the room or in the home is comfortable. Typically low to mid 70s is a good temperature for a newborn. Something that is protective is a pacifier. If your baby takes a pacifier, offer them one at nap time or when they're sleeping. That has been found to actually reduce the risk of SIDS. So pacifiers are good to prevent SIDS when your baby is sleeping. But the pacifiers that are attached to the clothes, do not use that to sleep because those strings can strangulate your baby. So pacifier in the mouth. If it falls out, you don't really need to put it back in. So pacifiers are okay. Just make sure it's not attached to a string when you're giving it to your baby to sleep at night. Smoking, very bad. While you're pregnant, after the baby is born, in the home, in the car, please avoid smoking entirely. And I'm talking not just nicotine, all smoking completely should be avoided, as that has also been shown to increase the risk of SIDS. So please, 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 if you're still smoking, try to avoid doing it in areas where your child sleeps or your child may go to. Swaddling is another thing I get asked about a lot. Swaddling a baby is okay as long as your baby does not know how to roll over yet. So typically the recommendation is in the first 2 months of life, because after that, babies start learning to roll over. So it's okay to swaddle your baby. Sometimes it helps prevent the startle reflex, which often wakes them up. So swaddle your baby is okay, but if your baby is learning how to roll over, is even rolling to their side, please stop swaddling completely, as that can actually encourage them to roll over completely, which can thereby increase the risk of SIDS. Co-sleeping is something else. Controversial topic. A lot of parents do it. It's actually encouraged in some other countries, but the American Academy of Pediatrics discourages all forms of co-sleeping, meaning your baby sleeping in the bed with you, sleeping on a couch with you, sleeping on a recliner. Co-sleeping, completely discouraged from the American Academy of Pediatrics, just because parents have rolled over and slept on their babies. Sometimes the mattresses are too soft, which can cause SIDS in babies. Sometimes the blankets, the babies get caught up in them. So just avoid co-sleeping entirely. If you're doing that for whatever reason, please, I beg you, make sure the mattress is firm. Make sure there's no loose bedding in the area. Make sure you're not sleeping with pets in the room. Make sure you are not impaired. You don't go to bed, under the influence of anything. Please, if you can avoid it entirely. If you must, continue to practice safe sleeping measures. Now, something else that is very important to note is a lot of people talk about these cardiorespiratory monitors. I'm not going to name any names, but the socks that you put on their feet that can measure their heart rate and their breathing, those have not been shown to reduce or prevent SIDS. Most of my parents that used it actually get more anxiety from it because they beep all the time. Continue to practice safe sleep measures. Because they have that sock on doesn't make it safe for them to sleep on their belly. Last but not least, so you've put your baby on their back and your baby rolls on their side, or your baby rolls over. It is okay to leave your baby alone. If your baby has the ability to roll over, then a lot of times the risk of SIDS is reduced because they have the ability to turn from right to left and get out of danger if, their face is stuck in a mattress or something like that. So continue to put them down to sleep on their back, but if they roll on their own, it's okay to leave them alone. All right, I think that's it. Any questions, any concerns, anything, please speak to your doctor for further guidance and direction. Until next time, stay safe and God bless.